I like to give a lot of blessing to all the guardian angels who have done donation and saved life, and to all who are registered and doing donation. I feel our dream, everyone's dream, is not to talk about World Blood Cancer Day, but to celebrate World No Blood Cancer Day. And for that, I think what we need to do is a simple step, just register. We just have to register ourselves. I must tell you, after Ansh got a donor, the next day, 14 of us, all my friends, my family members, we all got registered, and we are just waiting that we can save a life and get blessings.
We are here in Bangalore, and we are celebrating the World Blood Cancer Day on the 28th of May. And this day is about deleting blood cancer by DKMS BMST Foundation by looking for more donors who are registering to make a stem cell donation available for patients who are suffering from leukemia or other blood disorders like thalassemia.
Sir, what concrete steps to be taken for prevention of cancer?
Prevention of cancer. No. What we are doing is, in India you have more than 1 lakh diagnoses each year of leukemia or other blood disorders. And lots of these patients are in need of a stem cell donation. So they need an exchange of their stem cells, else they will not survive. That's the only option for them to survive. And when you don't find a donor in your family, so 70% of all these patients are in need of an unrelated donor. And these unrelated donors are not available in India. So currently we have 5 lakh donors available in India. We have several organizations, and 60,000 from DKMS BMST. And we need much more donors. So the first step is to register on the dkmsbmst.org, and then maybe next month, several months later, or even if several years later, you may get a call, and then we ask you voluntarily for a stem cell donation. This is a very simple process. Done, then you have the option to give to a patient a second chance.
How foundation can help cancer patients?
There are several options. So first is the registration. So we are doing drives in colleges, companies, or even army drives. So people have to register. We need much more registrations. Currently, like I said, 60,000 registrations we have. We need crores of registrations, 2 to 3 crores to help the majority of all patients who are suffering on blood cancer or other blood disorders.
So what made you to started the DKMS?
Excuse me?
What made you to start the DKMS?
Yeah, the DKMS started actually more than 30 years ago in Germany, so it's founded in Germany. But there is a huge need in India for more donors, and that's why we as an NGO decided to come to India to support patients in India, to find donors so that they have the second chance at life.
So can you cure the initial stage of cancer?
Cure means that you can only cure by eliminating the disease, and this is a long process. So the first step is a chemotherapy, and only when this is not working, which happens, then the next step is a transplantation. Without this transplantation, like Dr. Sunilbha just mentioned, it is fatal. The patient will die sooner or later. So, so we need more donors, and for this donor, it's for this donor which has a lot of courage. It's in the end simple process of donation. Then the stem cells going to the patient gets the stem cells. They're becoming genetic brothers, let's say, and with this, the patient can survive and can live his normal life